Okay. So Sona and I had this idea, like, well, so maybe people don't have to come to groups. Maybe we could make it available online. We digitized it. We got a grant from NIMH. We published it in a super high-tier journal in JAMA Psychiatry. We had good results compared to people receiving usual depression care at Kaiser in Colorado. And the impact of that was very, 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 very minimal. Very few people really engaged with the paper. Fewer people actually engaged with the program that we developed. And so the sense of despair came from feeling that, the sense of despair came from feeling like there's a need for. So the sense that we needed an outreach that was effective in engaging people in contemplative practices that might be scalable and easily offering people a low bar to entry is one of the ways that I thought we needed to move forward. And so in my work with Norm, we actually looked at contemplative practices from a kind of perspective of what is the common denominator, some might say the lowest common denominator, but what is the essential feature that many, many contemplative practices provide and teach? And can we offer multiple access points to these very same features without requiring the formal forms of practice? And we landed on sense foraging. We landed on the training of sensory awareness, the move from thinking into sensing, quieting the mind by moving from thoughts and concepts into direct experience as something that many, many different forms of contemplative practice offer. And then the question is, could we offer that in a way that's like from the ground up to engage people and to provide people with an opportunity to use that as a scaffold to build onto other things? And so then that's why we wrote the book. And that's why the book isn't an 8-week program. It's not another version of MBCT. It's not a book about mindfulness. It's actually about these kind of modular building blocks that start with sensation. And when you get into sensation, some very interesting things happen very naturally in the brain in the ways that sensation is connected to thinking, connected to emotion. And we were happy to get started, and this is where we are. The book's come out. And I think Norm can tell you maybe the other half of the story or the other side of the story.
Yeah, sure. Thanks, Zindel. Hi, everyone. We're really grateful for you spending some time with us tonight, even if some people are multitasking, such is life. So, I came into the picture as a new grad student trying to learn how to do neuroimaging, and Zindel was partnering with my lab supervisor to do these initial studies of what happens when people start doing meditation, and specifically mindfulness-based stress reduction. And we came in, I think, with a pretty strong theory for what we were going to find, which came from, I would say, maybe a bit of a naive understanding of the Buddhist literature and some sort of pop culture stuff around, getting out of your own way, that the self and attachment and all these things are often the cause of our suffering. And so what we should see, if we could find a part of the brain that was doing the attaching, like the self-referencing, that people who are suffering more were thinking, using this self-referential part of their brain more, and that people who were learning to benefit from mindfulness practice would figure out a way to turn off this brain region. This is a situation, I think, where it's quite useful to do science, because it was a situation where we were just really wrong. And it's not to say that that way of describing practice isn't useful to some people, like you're trying to sort of get rid of the self, but at least in terms of how it's playing out at a biological level, like the way the brain seems to be organizing and processing information, it doesn't seem to be what's happening when people do meditation practice. And before we kind of zoom into the specific effects of this study, I just want to get back to these introductory remarks and say, if a part of our project now is, if we think we really have discovered an important mechanism that's playing out in a fairly generalizable or universal way across how people's minds and their brains process emotion in a healthy and adaptive or unhealthy and sort of suffering generating way. A real question for us is how to communicate that. And as Zindel said, there's a bit of a disconnect between being like super enraptured with, oh, these practices are amazing, they changed my life, and then trying to communicate to someone for whom it's not like a natural attractor, right? There's a Tom Stoppard quote that says, we give advice by the bucket, but we take it by the grain, right? It's very hard to bring someone into your worldview around what's good to do. And we all of us know really healthy activities that we could probably be doing. And we're just like, yeah, but no, maybe tomorrow, right? So how do you know how to prioritize that something's actually worth your attention, actually worth your effort, especially if it means changing yourself in some way? And so I think what we're hoping to communicate today, if we had just like a main learning objective, kind of cues off of another quote, which is, I think, like a Viktor Frankl quote popularized by, I think it was maybe Nietzsche, who first said, if you know the why for something, if you really understand the why, then you can tolerate the how, right? I think I'm butchering the quote. He who has a why to live can bear almost any how, is the direct translation. So if you really understand what was happening that led you to feel a certain way, even if the prescription seemed surprising or antithetical to what you think is the obvious thing to do, it might be worth trying. So we think we've discovered a kind of really important fundamental mechanism of what happens when we experience stress, overwhelm, burnout, that has to do with essentially the shutdown of a lot of sensory processing in the brain. And we can get a bit more into that, but it's not the obvious parable of, well, you're just thinking about yourself as a conceptualized individual, and if you could just stop doing that, you would feel better, because that type of advice doesn't seem to be the kind of thing where people even take it and learn to know how to take the grain of it, despite the bucketfuls of advice that might be out there. So yeah, I think that's a bit of our motivation. But maybe in the interest of sort of sharing the stage back and forth, Zindel, maybe you want to talk a little bit about some of our early research. Does that sound good? Or sure, you want to take things?
No, maybe Paul, do you want to start us off with some questions, or
we could do a brief practice to sort of have the experiential element, whatever seems good.
I think a brief practice would be worth 1,000 words.
Okay. So the name of the game, I think, in a lot of what we've been talking about is this discovery that often when we're stressed, we end up blocking out sensation because that's where the bad feeling and the bad information is coming from. So in a very kind of natural way, but in a way that it ends up becoming deeply automatized and invisible to us. So we think that if we could just think more, we'll solve our problems, and we don't realize that we've forgotten in some way, like at a very deep level, that we have access to another mode that's exploratory and sensory. And to rebalance the scales, it is as simple as paying attention to the senses. So I thought we could just lead a brief practice about moving into sensation, if you're willing. If you don't want to do it and you want to wait it out for the question period, we'll be done in just a couple minutes. But the invitation here is, if it's comfortable for you, you can adopt, your contemplative seated position or something like that. But you can also experiment not doing that, and just think about this pure principle of, if I give attention to my senses for a while, something might actually shift in the balance in my brain, and that might actually be reflected in how I experience the world, how I relate to my experience. And it'll take us through just a quick tour of the senses. We can start with sight and just try to key in on something around your local environment, the room you're in, or if you're outside, the outdoor space you're in. Trying to notice something that you wouldn't normally be looking at. So where are places where your eyes wouldn't normally go, where you could be taking in visual information? Or is there a quality of something you could be taking in? Or could you pay attention to color, for instance? Could you pay attention to, like as an artist might do, where lines play out in space? And just really trying to explore your visual fields. If it helps, you can give yourself a fictional point every time you notice some aspect of your local environment that you normally would just sort of ignore or glaze over. And next, we might turn our attention to whether we can hear anything in the space. Maybe it's really quiet, and so there's more subtle sounds. Maybe it's really noisy and it all occurs as one thing, but the noise is actually made out of lots of different sounds. So again, seeing if there's a few different elements of sound that we can notice right now. Just bringing a sense of curiosity. There may be feelings inside your body, sensations on the skin. So trying to notice if there's anything that is an often ignored or subtle feeling inside the body or on the surface of the body. If nothing jumps out at you, perhaps sending your attention into a place in your body where you don't normally pay attention. There may be smells around you. Maybe a smell is you. So seeing if there's something that you can smell right now. Does the room have an odor? Have you just gotten so used to the place you're in? Is there anything you can actually smell if you give it a good sniff or two? And if it seems kind of silly, that's great. Let yourself be silly. Sniff around a little. And we can kind of follow the chain up all the way to the broader feeling that is coming in through all the senses. So what's the feeling tone that we have now as we're in this space together? It's a virtual space. And on one hand, you can be critical of not all being physically present, but at the same time, it's amazing that we're all able to connect in this way. So what does it feel like just to be in this physical space now, but also a social space that we're occupying? You can take a glance at other people's screenshots if you want, if it helps, or if you don't want to and just sort of want to feel your way in, that's fine too. And the final sort of step I would say would be to now sort of let yourself notice what it's like to be you. So has there been a shift out in any way around how task oriented or how much the mind is racing, thoughts are racing, feeling like there's something else to do? Has it been an opportunity or an affordance to drop into a more exploratory space just for a while? And what's that transition feel like? And if you are already practitioners of different contemplative practices, maybe this transition is something that's familiar to you. Maybe it's just a way in that in a different way, or maybe it feels different. But I think it's nice at the end of any of these sensory practices to come back and say, oh, what's it like now? So thank you so much for engaging in this brief practice. You can see that there's some overlap with maybe some contemplative practices you've done before, but also there's maybe a casualness to what we're doing here that suggests that you really could do it for a couple moments anytime during your day. Okay, with that, I'll conclude my brief practice leading, and maybe we can get into a little more Q&A and see if there's any reactions or questions to what we've brought up so far. Thank you for trying.
Thanks, Norm.
Mm-hmm.
Well, I have a question. How is this helpful? What's the mechanism by which this is?
That's an important question. I think that one of the ways that I understand it is that there is an intentional shift in attention into the sensory world, and there's also a willingness to be surprised. And the attitude of discovery and exploration, like Norman said, looking around the room, noticing something, maybe giving yourself a point for something you wouldn't ordinarily notice. These are attitudes of a kind of letting go into an immersive sensory moment, which can be a contrast, I think. I could be wrong about this. A contrast to the sort of more driven doing mode in which agendas and outcomes really predominate. So that kind of contrast starts to let people know that there is this other world. It's actually so close at hand because sensation is essentially ubiquitous. And the bar to entry is so low that it just involves this intentional shift of attention into whatever sense or whatever salient sensory experiences there. So once again, I love the fact that Norma talked about grains, because these are grains of insight. They're not big ticket insights, but they're little grains that are repeatable and very easy to access. And that would be my kind of take on how it can be practically helpful.
I mean, I'd give you the science nerds perspective is that we're solving the wrong problem a lot of the times when we're stressed. So we think that if I could just get away from these thoughts, or if I could get away from this thing in the world, then everything would be fine, right? Like if I didn't just have to keep thinking about this or dealing with this. And what we don't see that's happening, but we might observe, with brain imaging or something like that, is that the amount that people engage in this kind of cognitive efforting actually doesn't distinguish between someone who is resilient against depression versus someone who succumbs to recurrent depression. Everyone is thinking about themselves and can't help but think about their problems. Yes, some people experience that and report that is happening much more than others, but from the brain's perspective, everyone is doing that, and stopping that is not the fingerprint of the enlightened person or the person who is more balanced. But so it's trying to get rid of these kind of thoughts, making that the project, or trying to just not have problems to deal with, making that the project isn't actually the problem. The problem that we're seeing is this is happening to the detriment of being able to take in more information from the world. So in some ways, we're putting our life on pause because we're stressed, because we have a problem. And then we think if we could just solve the problem, like put even more effort into focusing on the problem, then we would be happier, then we would be relaxed, or then we would have room for whatever it is that we're missing. But what we don't see happening, because it's an absence, it's really hard to see an absence, is that all the sensory processing in our brain is shutting down. And the reason we feel stuck or hopeless, or like there's no room for connection, there's no room for love, there's no room for inspiration, is because all of those things come in from the world if we're open to it. And what we're doing is we're focusing so hard on protecting ourselves and solving this one problem, and then we'll open up that there's no new information coming in that allows us to change our own minds and realize, like, oh, well, I could just get myself a break right now if I just focused on this other thing, because we get this sort of tunnel vision. So it's helpful because although it's so basic, we would never be motivated. It would never occur to us that it's important enough to do when we're stressed. And it's exactly what's missing is sensory processing. And we start to just not even like force yourself, because it's not even that hard to do. Like Zindel was saying, it's beautiful. It's so close, right? It's always available to us to just move into a sensory state. We would let the world change us. And what we desperately want is not to just be stuck in this one state, but we think that we need to change ourselves. And that's not where change comes from. Change comes from letting the world change our minds, which comes through sensory processing. So we can see that the more people shut down sensation in reaction to stress, the more vulnerable they are to depression, even though it's in some ways like a sensible thing to do in the moment to protect yourselves. So that would be my like scientific mechanism account of why it's helpful that we can't see what the real problem is, but we would see a result if we were able to re-engage sensation. And there may be a lot of ways to do that.
So this sort of sense foraging is a way to interrupt some kind of stress process that we often carry with us much of the time. But your research has also somehow informed the effects of stress on sensation itself.
Yeah, I mean, we have found in two imaging studies that have replicated each other, an important feature of stress defined as negative affect in people who are vulnerable to depression, that the experience of affect activates, if you think of the brain as a kind of seesaw, where if one region is very active, other regions go a little bit silent because the active region tends to recruit a lot of resources, oxygen and sugar and things like that, glucose. So the active region gets the resources and takes it from other regions. The regions that tend to go dark that we found are the sensory parts of the brain that are on the sides, a little bit more towards the back. And so the experience of a negative affect or stress can be experienced in a way that is more conceptual, more idea-based, as a problem that needs to be solved, as a event that needs to be evaluated for self-reference and for threat, and experienced conceptually without the sensory signature that different emotions often have. And so what these practices do is to try to rebalance things a little bit so that an experience can be known through both the conceptual lens and the lens of its sensory signature, because those features can continue to feed forward, and then the person can know this sadness or this worry in a different kind of way, not just solely through concepts. The problem with concepts is that there are so many associations attached to concepts that people can very quickly predict, that this will be a problem and this will be here forever and this is never going to change. Whereas I think the sensory information can possibly provide a more fulsome description of the experience.
Yeah, like to tunnel just directly into the empirical findings, putting people in sad moods, like getting them to watch sad film clips in the scanner. We see that stress shuts down sensory processing in community samples. And it's the sensory shutdown that predicts how depressed people are outside the scanner, not the self-referential processing. In one of the largest studies of people with recurrent depression, stress again shuts down sensation. It shuts down sensation more if they have past episodes of depression, the more past episodes they have. So it's like a learned behavior in some way. It shuts down sensation more if they have more residual symptoms. So they're dealing with more of the accoutrement of depression. And it shuts down sensation more if they're going to relapse up to 2 years in the future. So we scan them and then we follow them with monthly check-ins for 2 years. So it's like past, present, and future suffering are all related to how much sensory processing, especially sensory processing for the representation of the body, but we also see it in other sensory cortices, which are very well defined anatomically compared to more abstract concepts. These areas getting less activation in response to especially negative emotions, sad mood inductions, things like that, are the like the canary in the coal mine. That something is awry. Someone is more vulnerable. And it's not that other people like lean more into bad feeling and start activating these cortices. Everyone actually that we see, or almost everyone, shuts down a little bit. But when it becomes a really deep reaction, deeply entrenched reaction, it becomes a risk marker.
For those who are actively depressed, are there special obstacles to being able to use this sort of practice?
I think in some ways the granular aspects of it can be helpful because they're easy to apprehend. It's not a big ask for people to, let's say, do what Norm asked us to do in leading an experience. I think that the bigger issue is the experiential avoidance. If people who have an acute episode of depression are already feeling really bad, they might ask you, well, I know I'm feeling bad. What do I need to do more of this for? And I think a kind of reflexive expectation of outcome, where if I do it and nothing changes, then what was the use of that? But I think that these are reactions that are sort of baked into depressive presentation, and whether it's these kinds of sense foraging practices, whether it's thought records in cognitive therapy, whether it's activities in a behavioral activation framework, the same avoidance and skepticism might show up. And I think it's important to find a way to work with them. And also, I think, to try to emphasize the exploratory discovery aspects rather than the hard deliverable aspects of these practices.
Yeah, in the brain terms, when we had a community sample of people do mindfulness training, they were able to mostly learn to stop the activating sensation after an 8-week MBSR program in response to a relatively minor stressor, like showing them sad movie clips or something like that. But people with recurrent depression, they don't just undo like decades of learned sensory avoidance. Instead, what we see that what they learn through therapy, especially if they're the people who manage to stay well in the 2-year follow-up, is they stop activating the parts of their brain that act as brake signals to the sensory regions, but the sensory regions don't just fully come back online after 8 weeks. So it's probably going to be like realistically a slower burn for them. In much the same way that behavioral activation is like a very thin edge of the wedge to start having experiences that are incongruent with depressogenic worldview. Like you're useless because you never do anything, so of course you think you're useless. But now you're only useless 99% of the time. 1% of the time you went for a walk, right? So that person is not all of a sudden going to become 100% happy with themselves right away. You got to play a slower game. And in the same way, what we see with people going through both mindfulness cognitive therapy or a wellness-oriented cognitive therapy, it doesn't actually seem to matter which one in terms of the sensory processing. The first thing they're learning to do is not to reflexively clamp down and inhibit sensation using a lot of this sort of prefrontal power. That's not sufficient in 8 weeks to start seeing them look like they're not still suppressing. They're just no longer deepening that conditioning, right? Whereas someone who's just a bit stressed in the community might in 8 weeks learn to change the level of sensory suppression directly because it's maybe not as deeply entrenched. So it's conjecture, but it's consistent with what we're seeing if we look at the two different studies and the difference between the community sample and the people with recurrent depression. So, but the principle is the same. It's just there's more ground to cover, I think, right? It's not like they're doing a totally different practice. It's just maybe it's going to take longer or a lifetime to get to the place where the suppression is getting to the place where someone else is lucky enough not to just have already, where the lack of suppression is where someone who feels like healthy and well is already operating at.
So in the book, you distinguished, I hope this isn't getting too granular, but you distinguished foraging for insight versus foraging for relief. Can you say something about what you're pointing to there?
Yeah, I think there is a way in which relief can be the first thing that people might experience when they engage in sense foraging, akin to distraction. And it's easy to distract yourself if you have a strong signal that you can attend to, and sensory experiences, of touch, of taste, of sounds, of color, going for a walk in, an environment that's constantly changing. These are ways in which we can step out of worry and recursive thinking patterns and things like that. So that would be an example of a way in which people can know that they don't have to be stuck in those patterns, and that can provide some relief. There isn't this other place to go. It's not very far. It takes a bit of attending to, but you can learn and discover new things in there, and that can, maybe quell a racing mind. But I think the issue of then using sense foraging to move back into thinking and to come back to thinking refreshed, and perhaps carrying with you some of the insights from this sensory encounter, might allow people to see the thought patterns that they've been engaged with in a different way, maybe in a more metacognitive way, maybe in a way that suggests new approaches to dealing with these thought patterns or these views that they're carrying. That would be an example of using sensation to step away from thinking, but then using sensation to eventually return to thinking, but now with embedded sense of the world through discovery, through contact, through engagement, that might allow us to develop a different relationship to that thinking. I mean, once again, pure conjecture. I mean, a lot of the stuff that we're talking about are extrapolations from the book. And you know, they may make sense, they may cohere, but they are still somewhat conjecturish. But you know, I think, you know, they're worth looking into.
Yeah. I mean, I think the primary thing, you see this also in like a mindfulness course or yoga course or something like this, that people get when they first start contemplative practice often is they learn how to experience like a relaxation response, right? Before the mindfulness movement is like Herbert Benson just talking about like focus on your breath for a while and eventually, you know, your blood vessels stop like clenching down tight and you start feeling like, oh yeah, like maybe I'm not about to die right now. And so I think there's a sort of a trans therapeutic arc where the first things that happen when people find something that's really an attractor state for them is that sense of relief. I think there's something in terms of like that there is an arc where eventually we are hoping that people are going to start to notice their feeling tone or how even their sensory habits are related to their environment, and this is a chance for insight. But at the very beginning, it's going to be about realizing that there is another mode to slip into that is a break from having to hold on to these problem-solving, evaluative, and sometimes very like negative self-referential habits. So what's interesting is just the idea that is maybe a little bit controversial in the mindfulness world, that you don't have to necessarily go deep into the body right away to get that kind of relief, right? But now in an age where there's a lot more trauma-informed mindfulness, for instance, you might do a body scan where you're very peripheral to the body because you know how deeply conditioned, you know, the chest region is to trauma association. You might do a drawing practice, an art therapy practice, because the person is not ready to start going directly into feeling tone, even if the feeling tone is going to be where you could argue there's greater potential for insight. That's only if they feel like they can engage in that feeling tone. And so it's not necessarily better or worse to go looking for relief first if it's about just learning to trust your attention and your ability to get into sensation if that trust isn't there. I'm also riffing off a little bit off of Zev's comments in the chat right now. And because what we see when we do neuroimaging of turning towards internal sensation is that it's a much more nuanced kind of process. The brain has to kind of quiet down. So you have to have a sort of sense of stability and trust and calm, and you still have to be able to pay attention and notice things when you're in there. In some ways, we're much more built to just immerse ourselves and absorb ourselves in an external sensation. But if we can do that with a sense of curiosity and sort of notice what it's like to be in that sensory state, we may grow in our confidence and eventually competence to explore other sensory domains that we're not as comfortable with, or maybe we're outright uncomfortable with. So there can be a bit of a scaffolding there. And so that provides relief. And once we have this, if you knew that you could give yourself relief, like we take for granted, you know, when I first learned mindfulness practices, you just say, oh, if you're having trouble with thoughts, just go back to the breath. But what if the breath isn't safe? Right? So you need somewhere where you know you have some capacity to engage in relief before it's really safe to start picking at like, well, what is my deep learned conditioning? What really is happening in here? For some people, it's fine to just go right in there, and for other people, it might not be. So it really is about exploration, but in a directed way where you want to give yourself a sense of trust and capacity, and then kind of grow from there. And then, you know, if I had to guess based on everything I know and learned so far, a lot of the insights are going to come from coming into like that internal conditioning, right? Like the fact where your eyes look when you're walking down the street probably isn't going to tell you as much about where your reactivity is coming from as opposed to like where you start feeling your heart pounding, your breath changes and you feel sick and all these sorts of things. But you need to be ready to look there in a way where you still can be quiet and notice patterns And if that's not available, there's nothing wrong with focusing on building these kind of relief capacities. You should not just dismiss it as a distraction. It might actually be a skill building process first. So as Zindel says, this is conjecture in terms of that we haven't fully isolated like these processes and showed that one happens before the other, but it's informed by a lot of what we know about different contemplative and clinical traditions.
One of the things that strikes me is how much crossover there is here, of course, with mindfulness practice, and also that you're somewhat deftly avoiding falling into that familiar verbiage about mindfulness, really seeking a different way in. But with that in mind, I want to bring you to a particular quote that I found in the book that struck me. You wrote, "Mindfulness meditation's benefits don't come from getting rid of the self. What the data showed was an expansion of the self in the form of immediate sensory input. The negative self-judgments are weakened, not by judging judgment and suppressing the impulse, but by enriching the self-concept with novel, conflicting, disruptive, and ultimately creative experiences." Can you say something about that? Because this is a different way of thinking about the impact on the self of this kind of contemplative practice.
Yeah, I think context would be helpful here. This was a study that was formulated in, I think, around 2005. When you think about 2005, the first MBCT study was published in 2000. And that was a clinical trial. And then some of Sarah Lazar and some of Richie Davidson's early neuroimaging studies were coming out at around the same time. And in those days, there was the idea that an important target of meditation practice was reducing self-reference. Self-reference was a big problem for people, and in terms of Buddhist and clinical writings, it was identified as keeping things like a very static, unchanging, selfish view intact. It fed rumination. It perpetuated all kinds of clinical symptoms. So one of the ideas was that meditation could reduce self-reference. It could be an important target, and it could also explain why, if it was reduced, people would find themselves feeling more intact, less separate from others, greater sense of agency, and also carrying a lower symptom burden. And so we thought that with an effective clinical training program and a neuroimaging layer on top of that, we would see people who were responders to this program who took up meditation practices showing reduced areas of self-reference. And the advantage, too, is that the self-reference regions in the brain were very well known. They've been mapped out in earlier studies of levels of processing and semantic memory. And we could really see, did meditation change these areas? And we fully expected it to. And we had people who complied and practiced meditation and were in an MBSR course, and it was taught by really good teachers, and they showed symptom relief as well. And we just could not find any real reduction in those regions. And no matter how we looked, and we did look up and down, sideways, and all over, instead, what we found was that the people who did really well in terms of practice and symptom reduction were people who opened up this sensory portal. And so they were able to create a space. We don't need to call it a self space, but a space in which their experience of themselves was now able to contain elements of conceptual views of identity or self alongside elements of sensory experiences. And those two things together suggested a broader or a broadening view of self-awareness in any moment compared to people who weren't able to open that sensory portal, remained defined by the tendencies for self-reference, and actually did a lot poorer in these groups and also had lower levels of engagement and of actual practice frequency.
Yeah, I think that a great description of the studies and its implications. I mean, the one thing I would say where I'm probably put my foot in it because it's not my expertise is like my understanding of the traditional view on the self is not that there is no such process as self-identification, or even that the process of self-identification is pathological. It's that treating the self as a static object is the problem, that there's a real thing, that like an unchanging thing, a truer essence that's like a one unchanging essence. That's the mistake. From what we know, like in terms of Western clinical traditions, getting rid of the ability to engage in self-reference is pathological. We call it like, derealization, depersonalization. So the problem is not that we engage in self-reference. It's that we make a kind of error when we do that and think we're discovering that one pattern of self-reference is the like capital T true or accurate form of the self that we need to, and it should not be changing. When everything we know is that the ability to make sense of the world that's changing requires that like how we are in relation to it also needs to be changing, which requires self-reference. So the question from like a neural perspective is, are you letting information be integrated from your internal and external experiences that updates your stance, your relationship with the world? So are you letting self-reference be informed by new information? So, and that's really what we think is what we're seeing in the benefits of like doing MBSR and feeling better after doing it, is that people are realizing like I can have myself and it's not threatened by being dynamic, by being informed continuously at some level by what I'm sensing and feeling right now. And if I'm doing that, I'm getting my self cake and my impermanence dessert too, right? Like, or that's two desserts, but whatever. Like there's something wholesome in there, right? That I'm getting to have a sense of self, but it's also I'm not making this mistake and thinking I need to stop anything from affecting it. In fact, I'm realizing that maybe I'm much more resilient when something I can actually change how I feel to the world. I don't have to always be defensive or brittle because either I resist things or it breaks me. And I think that's what we're seeing at a neural level, that a self that includes not just the conceptual stuff that we already know, but is allowing ourselves to be updated and changed by having integration of the sensory processes at the same time, as opposed to them being antithetical or opponent processes. That seems like a characteristic of people who are learning to have that kind of flexible form of self-reference. So that's what I mean by the expansion of the self, not the like the colonization of every reach of the mind to become some unchanging statue. Like it's expanded now so that now nothing will ever change me because I have even better defenses, would be not what we meant with that quote, I would say.
Yeah, what you're describing is what in mindfulness circles is sometimes just described as becoming a larger container.
Mm.
I think this is what you're describing.
Yeah, I think so. A container where itself is not just what I already know of myself, but also what I'm discovering, and that's a very different place to stand, I think.
Mm-hmm. So I just want to remind folks that you can post questions to the chat as well. Get me out of the business of asking all the questions here. I can surely keep going until other people have things they do want to ask, but maybe getting a little bit practical. How do you get people started?
Once again, context is important. If you're doing it in a clinical context, I think it's one thing. If you're guiding mindfulness practices, then I think I've heard all kinds of mindfulness practices that are guided from a very conceptual template of arriving in this state, arriving in that state, arriving in these states that are largely conceptual, and they are bereft of, I think, sensory connection. And so one thing that I've tried to do is when I guide, to be very sensory referent, and to be pointing less to conceptual states that people may or may not notice. And I think you also see this on YouTube and widely available formats for people accessing free of charge contemplative practices. If you go onto YouTube and, for example, probably like, 35, 40, 50 versions of a 3-minute breathing space on YouTube. I've seen people in their pajamas guiding it from a house somewhere in the Midlands of the UK. And they have lights on, they'll have music. I mean, these are implicit ideas about how meditation can be, or mindfulness can be practiced. And the additional elements suggest a kind of relaxation, a kind of emptying the mind, a kind of way in which everything sort of goes quiet. And we know that that's often not the approach inside mindfulness, which often invites us to have an encounter with whatever shows up, including an encounter with the difficult. So I think that sprinkling in a way of guiding that emphasizes and keeps people very close to the sensory world as it changes during practice is very important. Clinically, I found that people aren't too resistant when it comes to sensory practices and sense foraging. I think that the larger challenge with sense foraging and clinical work is that people follow very familiar scripts. And the whole point of sense foraging is to really help them move into a discovery and exploration mode. And so we've had suggestions of people doing things like eating popcorn with chopsticks or eating a meal with a non-dominant hand, and noticing the ways in which assumptions or expectations don't necessarily get confirmed. New experiences of clumsiness, maybe even judgment arise, but also ways of breaking out of molds of, I already know what this is going to be. I know what this food will taste like. I know what I can find when I go on a walk, and encouraging people, as Norm did, with taking notice of places where their attention lands on something new and unexpected. It's this willingness to be surprised with an encounter. And I think that can lead to informed clinical discussion around allowing newness in. And the emphasis isn't so much on reward and on positivity. It's much more on engaging with this mode of discovery and exploration and uncertainty.
I mean, it's an empirical question whether specific, what we call like access points to sensory practice are just flat out better than others. But if we look at like the history of, psychotherapy, when we're like, I'm going to show that, Gestalt therapy can kick like this exposure therapies, but it's like a lot of it's like, well, for whom and when, and is there like therapeutic lines? And there's a lot of these sort of general, it's just sort of like a failed project to show that one therapy was like better than another, like full stop. So, but there may be differences. And I think there are differences that we already been pointed to in the chat, even between going outside and going within. I know in mindfulness practices, the idea that you have to be able to sit with the internal stuff for that quietness or stillness to be discovered. There may be a hierarchy or progression there, but those are all just my like caveats before saying what I actually want to say. The sensory practice that's the best for someone is the one that they'll actually do. And so you can have all this theory, but if I think the primary like target when you're just trying to get someone to begin, which I think is the question, would be like an access point that they feel comfortable with. So if they love music, like start with music. If they love visual arts, start with visual arts. If they find there's just something about going and walking in the garden for a while, like get them to do that intentionally as their foraging practice. And yeah, like we'll have to hash out whether there's like different levels that they have to move up to. But remember the first level we're kind of talking about is using sensation just to start to tip the scales back into balance in a mind that's become very focused on perpetuating mental habits. And so from that model, right, and it's a model we're testing, we're all going to, like, there are things we'll discover along the way, but from that model, the prediction is like that in itself will be really a really important step. So we talk about different access points, including like exercise, art, time in nature, a time with friends where you're actually paying attention, like you don't have your phones out and you're actually like noticing what it's like to be in relationship with other people. We give a little tip of the hat to the burgeoning fascination with psychedelics. All of these kind of different practices, and many of them have been around for millennia because there's something there for people, could be access points. And it's about, I don't know if I'm going to steal an anecdote you want to tell, Zindel, but like when we were talking Sharon Salzberg about like, is this okay? She gave us this idea of like many brief practices, many times a day, right? Like, so there's something about trying to develop this attentional muscle and develop stability and find this way to get into this really beautiful, quiet, still pond ideal on one end. But there's also just like, how do you get going? And it's like, just learn to give yourself these micro practices to begin. You don't have to run the marathon or go on the retreat or something like that right away. Find a way that you can drop a sensation even briefly and learn how to just like get into that with an access point that makes sense. We talked about, I think, knitting briefly in the book, and someone emailed me about how they're like, yeah, nothing worked. I did all the therapies, but then I found a knitting circle and like, that's my therapy now. But then she's like, because it's like the clack of the needles, and there's other things there. There's like a supportive group dynamic to get the therapeutic facilitation, but it's mostly about this like this sensory motor exercise that's engaging, and it pulls her out of all the other stuff that's going on. And for her, that's her access point. So like, we don't need to find a theoretical reason for why that's wrong, right? And then it doesn't preclude there being more advanced practices after you're able to give yourself that sense of relief and stability in a sensory state. But, we're talking about the thin edge of the wedge here, and most people aren't doing that. So before we wonder about like, how are you going to get to deep stillness and notice the impermanence of your internal experience and your layers of conditioning, like if you can't even go sensory for a couple of seconds in a non-threatening sensory domain, like, why are you telling people this other stuff? Like, it seems like there's no hope. Like, it's not going to work. And for other people, they're ready for it, right? So I'm rambling on a bit right now, but I think we really have to just be realistic of like meeting people where they are. And if the initial symptom is like they can't go sensory at all, it doesn't seem safe, like give them, like, be as inventive and playful and generous as you can in encouraging them just to go into a sensory place. And then when there's some comfort there, like, yeah, then we can go on to the next step. We predict, and this is something we're trying to test in this year and the coming years in research, just giving people that kind of practice is already going to start paying dividends and be the beginning of trying to really create a model of all this theory.
So there are some questions in the chat. Andrea, do you want to ask your question aloud?
They sort of spoke to it. I was just wondering about how, besides the practice that you did in the very beginning, how to sort of enact this. And you just spoke to it, pretty much about doing it in little doses and whatever modality is comfortable for people, and focus on the means of have it be curious and have it be playful and discovery. So that was helpful. Also, I think interesting, when you were talking, I was thinking about the sort of Alzheimer's aging research on the brain and how important it is to do novel things, to sort of teach yourself different things. It seems like there's a little bit of overlap in, kind of what you're saying in some of that research, or at least it's compatible. Anyway, thanks.
Thanks, Andrea.
Yeah, I can't help myself. Like, you're not going to stop yourself from having dementia by doing sense foraging practices. So I just want to throw that out there. But a lot of dementia is interpersonal. Like the functional deficits in dementia interpersonal. So if you're playful with someone who has Alzheimer's and they can be playful back with you, they still have profound many memory impairments, but their quality of life in that moment is actually pretty high, right? So there's a wonderful article about that in the Guardian in the big ideas column. Maybe I can post the link to that about how there's maybe a wistfulness, like, oh, this is actually the way to make my brain regrow when there's plaques and tangles in there, and I think that's part of the, like, I need to change things and control them kind of trap. But there's another way of relating that happens from the senses, where even someone with a lot of neurocognitive impairments doesn't have to be unequal or less than when we're not playing these like conceptual ranking games. So anyway, it's an interesting area to talk more about.
Brian has a question.
Sure. Thank you. Appreciate it. This is a great discussion. I appreciate it. I think you partly answered the question already. But folks, no one ever does anything that's 100% negative for themselves. When they have their stress response, when they're dealing with all that they're dealing with, they're reluctant to let it go and to try something new. And when they do try something, they feel as if they're drifting away from what was very protective for them. And you mentioned, well, start in small ways, or maybe there's other ways to access it. Maybe small wins are enough. And I suppose that's part of it. But it does seem to be this pull to go back to the behavior that was not really helpful to them in the longer term to help them feel protected. And I was wondering if you just have a thought on that.
Yeah, Mark, Brian, I agree with you. It is a balancing act. And so how can we help to pull them over a little bit onto the side of uncertainty, letting go, and experiencing something without the guarantee of knowing its outcome? And I think that sensation and certain kinds of sensory practices can land on neutral stimuli where they can be encouraged to explore and discover and see new things. That may or may not be enough to get them to shift in terms of broader patterns of activity related to how they usually cope with stress, but it might allow them to see that even in those kinds of experiences, there may be a little bit of relief, and possibly that might be rewarding enough to get them to try and do something else. So I think what Norman said too, if you can find the stimuli that are relatively neutral and get them to explore, and there it might be an easier ask than something that's a bit more challenging.
Francis had a question.
Yeah. Hi.
You're muted, Francis.
Oops. What happened to you? Let me see if I can undo that. Okay,
Hi.
let's try again.
Hi.
Hi.
Hi. Thanks so much. I have a question. I wrote in the chat, I was wondering about the differences between practices like what Norm shared with us, something simple where you might be in your office or on your couch and noticing basic sensory stimulation, versus putting yourself in an extreme environment that's really novel to you. With the latter being kind of reminding me of practices of awe, like put intent, like Dacher Keldner talks about putting yourself in situations where you can intentionally experience awe. And I wonder about the differences between those. But as I say that, I realize I'm not really sure what I mean. Like, what kind of differences am I asking about? Maybe I mean differences in the brain. Like, how do those different kinds of experiences affect people? But I don't know. You can answer that in whatever way might make sense to you.
I'm glad you raised the word awe, because I was thinking about this phrase that I've heard. It's called wordless moments. And it seems to me wordless moments are one of the things that happen when people feel a sense of awe. They are taken by a powerful, intense moment, but they're not really using words to describe it. They're either feeling their way into it, or there may be a sensory experience. And so I think that what we're getting at is a wordless moment or wordless moments that can be appreciated through sense foraging, where people are stepping out of the need to categorize and explain to themselves what's happening, and instead have a more direct experience of walking through leaves on a path, or looking at a sky and noticing an intense color, or maybe listening to the sounds of birds or other things that come up where the experience is more direct, almost in a sort of Zen Buddhist way in which we're trying to get the mind out of the way and to have a direct experience that's unfiltered. So these wordless moments do show up in experiences and moments of awe. I think for us, our interest is in trying to draw people near to those experiences in everyday life without the need to manufacture awe as a bridge into them.
Yeah, I think our thinking is totally surprisingly is aligned here. Like, I mean, it's about scaffolding, or like sort of the like going into a really intense experience. It's sort of like you're letting the environment, either external, if you go, go up on top of a mountain, you see like a breathtaking, performance or work of art, you take a big hit of psychedelics. Like, it's doing a lot of the work for you, and that itself can be an attractor state, right? Like, I think part of why, one of the reasons that's not just pure like corporate greed, that there's so much enthusiasm around the psychedelics movement, is because people get to have this like totally disruptive, sensorily rich experience that temporarily suppresses their business as usual in terms of like their sense of identity and their relationship to the world. And then when they come down, they remember elements of it and are like, wow, like what else is possible? In the same way that you can have a really intense like artistic experience or a connection with nature, these sort of awe experiences where we know that the self-referential parts of the brain do get disrupted in a way that we weren't showing in like a more self-paced mindfulness practice, let's say. But your attention is really engaged and you're trying to integrate and make sense of the information, and your sense of the self is kind of diminished. But, after the ecstasy, the laundry, right? And it's sort of, and I think in the end of the day, like where this is going to make a difference is when people realize, like, when it's just the same old day and you still have access to this mode, this is where you're going to see behavior change in how someone reacts to like a child or a partner or a parent or a coworker where something is stressful. I think it's really important for people who are really, really stuck to have scaffolding, or even if they're really stuck, they just don't know that there's other modes of reference other than business as usual available to them. It can be really important to give them these kind of experiences so they get this sort of like, wow, I didn't know that was possible sort of moment. But if we're always chasing like the mountaintop, where it's going to be inevitably disappointing, and it's not really where the real work is. I think the real work is like, I'm sitting at my desk and I'm frustrated and I want to say something like judgy at this person who's bothering me, and like, can I just tap in for a second and know and like see what else is possible? So yeah, again, these are all sort of like what the right dose and recipe is, I think, is still a work in progress. But it doesn't have to be big, right? It's more that it should be, it's like, what if it was just always available, when there is no fanfare? That would be like powerful, right? So anyway, that's my take on it. I think there's lots of room to have different opinions and ways to think about how this might all play
out. So Nicole had a question. Nicole, do you want to ask this out loud? You can unmute, or I can ask on your behalf. Well, perhaps I will ask on Nicole's behalf. Thank you for sharing your knowledge. How would your research impact patients experiencing PTSD and relieving some of the neurological changes in the brain?
Who knows? Honestly. I'm not trying to be flippant about it. I think there's so much in PTSD that is overdetermined and occurring at so many different levels. I mean, it's possible that apart from the trauma treatment, this might be a way of accessing or kindling a kind of reward circuitry that may be shut down in patients with PTSD, to help them re-engage with the natural world in ways that doesn't prove to be terribly demanding and that might be blunted because of an overactive fear response. But I'm just speculating. It's interesting, though. I will tell you, and it's, I think, kind of a curious side note. When we were shopping for publishers for this book, one publisher was very interested, but they wanted us to write a book that had an 8-week sense foraging program in it. But they wanted that to be the book. They didn't want it to be the book that we ended up writing, which doesn't have, here's the 8-week MBCT proxy version of sense foraging, and do this in session 1 and session 2. So we do get a lot of these questions around how would you implement it, but I think we feel like it's a little bit, or at least I feel, I don't want to speak for Norm, it's a little bit premature to insert this into treatment of severe clinical disorders. But some of the nuggets of information and some of the nuggets of application might eventually find their way into some kind of protocol. We just weren't ready or felt like we even had enough background to write something that was protocolized.
Yeah, I'll brief. Like I totally agree. It would be a bit irresponsible to talk about a clinical population that we don't have a lot of direct experience working with. Like my understanding of the neuroscience around PTSD in regards to sensory processing is that there does seem to be issues around what is called sensory modulation. If you show a lot of quick images to someone with PTSD, you'll see that a lot of the default mode network, like the habit network, the self-referential network, turns on much more than for someone who doesn't have a PTSD diagnosis. And it seems to be like a defensive reaction. So they'll shift into habit mode much more easily when bombarded by sensory stimuli. So the way into renegotiating that, that's a huge, you need a lot of clinical experience and care. I wouldn't just be like, hey, let's do a bunch of sense foraging and then set off all of your defense mechanisms. So yeah, I think there's definitely some association there between needing to get away from the intensity of sensory experience. So we think about, descriptions of the anxiety around having these kind of flashbacks that are very sensory. They're too rich in a sensory way. But I don't think we're ready to give clinical guidelines, as Zindel was saying. But it does seem to be the relationship to sensation and experiential avoidance, and do people doing what makes sense at the moment to protect themselves and their minds. It all fits with what we're talking about, but we just don't have the direct experience to say more at this point.
Hey, thanks, Paul. My name's Lieve. I just had a related question, and if it also feels premature, please punt it. But from a slightly different approach, might you elaborate how sense foraging processes map onto brain circuitry insofar as they are understood to? So for instance, via novelty or discovery, are they serving as a sort of adaptive competition for amygdala function that remains connected to mitigating executive influence? Again, just throwing ideas out there, hoping that can get some legs on it.
Norm?
I'll take I'll say some brain words. Yeah, I think, okay, well, one thing I would say just to get this conversation started is the parts of the brain that we know definitely what they're doing are the sensory regions, right? Where you think about your grandma or what to have for dinner, that's highly acquired and idiosyncratic. But unless you've had some kind of catastrophic traumatic brain injury at a young age and there's been some neuroplasticity, everyone is doing vision in the back of the head. You have an upside down homunculus of your body with the feet up here going down the hairband. Sound is always right inside the ears. The internal representation of the body is where the tongue region begins. If you go inwards, that's over the lips, past the lips, over the gums, watch out tummy, here it comes. That's how it works with the brain. You go in from that part of the map inwards and then forwards, and you get the internal representation of the body. It's the same for the vast majority of 8 billion plus people on Earth. So we know where sensory processing is happening at the building blocks of sensation. What happens afterwards is really, really hard to classify, and lots of people are trying to do so, but largely aren't. It's very hard to do. And we also know that if you pay attention to any one sensory domain and you give it a decent try, you will divert processing resources like oxygen for burning glucose and getting all those cells active. You will activate those regions. And this has been done by people who don't care at all about meditation, like people just looking at visual versus auditory processing because, hey, they're neuroscientists. So attention is sufficient, even without a lot of special training, to activate sensory regions of the brain. And we know that these regions are sensory regions. So, so you can just like divert, and if it's a zero-sum game, you only have so much oxygen and glucose to burn at any moment in time. So you can already, just by paying attention to your senses, pull some of the processing resources from anything else that's associative or learned or conceptual into sensory regions just by paying attention. That's why we talk about it being so ubiquitous and available and almost like too simple. When you start talking about things like the amygdala as like a reward or novelty detector, I think you're talking about it in its role as part of what's called like the salience network, which is supposed to indicate to us what is most motivationally or emotionally relevant at any one point in time. And it's supposed to help arbitrate between, or should we do something business as usual, engaging habit in this default mode network, or should we be using like effortful cognitive attentional resources? And I think what we're trying to learn to do when we drop into sensation is to treat the sensory processing as important. So, and this is very like congruent with this idea of like having a beginner's mind or seeing things like when not, as we've been trying to talk about it with curiosity and like not really knowing what they are. If you notice something new, you're going to be engaging that kind of salience network process, but doing it in a sort of intentional top-down way. A lot of times it's activating because something shows up that we're not already paying attention to. But I don't, and I guess the one other piece I'll throw into the melting pot of rambling I'm putting in is when we look at people who do meditation training compared to those who haven't done it, we see that the ability of sensory processing, especially from the insula, with the body's internal representation state, is processing forward towards the front of the brain. It starts back by the lips and gums region and then moves forward toward the front of the brain, where you'd maybe have some ability to be aware and articulate and label the experience. But all the other sensory processes are also competing to activate this anterior insula part of the brain and grab your attention. And so are so it becomes like this sensory hub where it's like a bottleneck. And what meditation training, for instance, seems to do is help to shift the balance of power a little bit so that there isn't that vision, for instance, isn't always just trumping internal sensation. But you can, if you generalize from that, because that's a very specific, breath and body practice where you're focusing on raising the salience, and use that term intentionally, of internal body states, you could generally try to raise the salience of sensory representations over like conceptual, like thoughts, memories, and other sorts of things we do when we spin our wheels analytically to occupy and sort of demand our attention by practicing, like acting as though they're important. And the brain will start being like, oh, okay, now I become conditioned that this is actually important. So it's a bit of conjecture mixed in with some of the evidence, but just to summarize, attention's enough to already activate clear sensory parts of the brain. And if we can really bring the attitudinal qualities to that engagement, we might actually be able to have more chronic or trait-like changes in those sensory qualities, being better able to compete with all the really juicy conceptual symbolic reward sort of stuff that normally hijacks our attention and on purpose is designed to hijack our attention with things like social media. So that would be my talking too fast way of trying to grapple with your question. But I think it's a super cool area to get into.
Well, there's some lovely comments in the chat, but I want to stay with questions. There are none queued up right now. So let me ask either you, Norman, or Zindel, what question do you wish we had asked that allowed you to get to some point that you think maybe hasn't been made thoroughly as thoroughly as you'd like?
feel pretty sated with the variety of questions we've had to field. I do notice that it is a going back and forth between a kind of clinical and a neuroscience narrative, which is interesting to us. I hope it's interesting to the audience as well.
Well, Norman had offered me this as a potential question. So I'll draw on that. How does your approach inform how someone would approach mindfulness or other types of therapeutic practices? I know you've kind of touched on this, but I wonder if there's more you want to say about that.
Well, I mean, I think there's so much in therapy these days that talks about somatic experiencing the body as a terminus for emotional experience. So it definitely feeds into that. I think it is a way of offering pragmatic tools for people to work with sensory experience that doesn't have to be featured as a component of distress. And people can get to know the sensory world in this way because it is ubiquitous, it is immersive, and it can be absorbing in a way that can enhance people's skills at knowing what their sensations are actually doing and staying closer to them. And I think in terms of the mindfulness piece, I did already comment on how teachers might want to look at the way they guide practices and remind themselves to stay very close to the sensations that are occurring in the body that in and of themselves can be wonderful teaching places rather than adding concepts and ideas of things that sometimes people have a difficult time apprehending. At least that's what I've noticed.
Yeah, I think one thing I want to try to communicate is this idea that I think a lot of times when you do like formal mindfulness practice, you're really trying to get people to enter some kind of like rarefied state. Like it's almost like held at, like, why make them do it for like 20 minutes? Why tell them like, what, the original, like the John Kabat-Zinn CDs, like 45-minute long body scans. So like what's supposed to happen in minute 40 that couldn't happen in minute 1 or 2? And there probably are, I'm sure there are differences like relaxation responses in this, but there's this idea that I'm trying to get at, that you're trying to like develop this stable, like really strong attention. And that's one theory of what's going to be helpful. And we're playing with like a different theory that doesn't necessarily try to invalidate that, but what mattered more is having the habit of paying attention to your senses, even if it's right. And this is built into, I think, how mindfulness is taught, but it's not always emphasized. Like, just start again, right? If you're at a Goenka retreat, like he says, start again all the time in the recordings, right? And most mindfulness teachers will just constantly give reinforcement, like your mind naturally, you're going to notice it wanders, and all there is to do is just build the habit of turning back to your sensation. But sometimes what's slipped in there is this thing, like, and then you're going to develop this superpower where your mind doesn't wander. Maybe it'll be less and less, and oh, wouldn't that be a nice session? But what we're kind of pointing to more is like the habit of recognizing what it's like when you feel like the walls closing in. Like, can you notice that absence of what it's like when sensation starts to drop out, and just get back in that habit of turning to sensation as a way of rebalancing the scales? If you were able to just do that a little bit whenever that happened, there might be no other superpower. Like the habit might be the superpower, not that you're able to form this like crystal mind that is like perfectly still and can just be completely absorbed in one thing. And like, let's let those theories compete. Let's, like, you can see who's happier if you find the people who are great absorbers versus the people who just have like a momentary habit, not a daily habit, a momentary habit of checking in with sensation, and see like who's more adaptive, who's happier, who's having better relationships. Like, So I think that's like it's just an interesting thing to think about, right? Of like what do you want to emphasize when you're teaching? Because both of them are in there, but I think sometimes people think they're going to get somewhere where they've built up. It's like getting big biceps or something like that, as opposed to having the practice of going to the gym, right? And what are we really trying to emphasize? Like it's the practice of being active, not worrying about getting that power that can sometimes be built into like these super long practices. So yeah, many practices, many moments, many times a day is sort of like a bit of a tweak. Yeah.
Good. Well, by my clock, we've got 1 minute left, so I think this may be a good time for us to bring this to a close. Thank you so much, both of you, for your time and especially for your work. I think this has the potential of being a real value to our patients and to ourselves. So thank you for your time, your work, and thanks all of you for attending and for your thoughtful questions. And if you want to revisit this, the video will be posted somewhere. That I can promise. I can't say where. Okay?
And thank you, Paul, for helping us make this work come alive through the questions and the interactivity and everything else. Really appreciate it. And thanks, everyone, for the time and your attention.
Yeah, said it perfectly, Zindel. Thanks, everyone, so much for coming. Thanks, Paul.
Bye-bye.